I will start with the myocardium. The ongoing discussion, of course, between the fraction around McCullough and FLCCC and us maybe is the strict concentration on the vaccine, myocarditis. And I say, yeah, but the virus can do myocardial necrosis. Very clearly shown here. So I would say that we don't have to discuss, we are all right. We just have to take both into account. And the problem is here that now Omicron is mutating in the wrong direction. It gets much more, it gets better and better in infecting and causing all the same problems as the Delta and the vaccine. Infiltration of lymphocytes, direct damage, direct infection. We see more later. I have more examples what it can do to the cardiomyocytes, etc. So it is a virus that we have to be careful with, especially in regards to the heart. And then, of course, everybody knows this year now the arrhythmia and myocarditis and how it looks like, and that's been known since many years. Usually, it's the infiltration of lymphocytes into the myocardium, for example, causing inflammation and inflammatory damage. It's very well documented. We did in 2020, when we started to work on our bioavailability of the product and started to look at different options, including emulsions. The first thing we did, actually, when we played around with all these molecules, we checked how we tried to prove how well our bioavailability works in an animal model by inducing an artificial heart attack. So it was not per se to show how we can stop a heart attack. I needed one example in an animal lab to show how could we improve the bioavailability. And when we reached this point here, I think then we were happy with the results to show that between animals that didn't take supplements and the one that took supplements is a pretty impressive difference, I would say, in protecting the heart tissue. And as this has been done with isoproteinorol, which is a catecholamine, that is another angle why so many young athletes, probably, especially male athletes, keel over on the field when they're doing sports activities or die in the early morning hours when they sleep, because the catecholamines that are upregulated, especially in young males, can increase the problems with causing myocarditis or myocardial infarction, obviously. Yeah. But now we get to the point that is really, I would say, that is one of the biggest problems we face now, and that's the vasculature and the microvasculature. We had some very interesting wake-up moments in the last few months when we tried to induce vaccine injury in the hamsters, and it didn't work. We injected 100 times the lethal dose of mRNA vaccine, and the animals are happy and healthy afterwards. Okay, so why is that? Why do some people really, really suffer and others don't? And so I'm daring to call out the medical community and say, as long as we have an intact glycocalyx, we are pretty safe. So the glycocalyx, if you look at a cut through an artery, is like a carpet, very fine carpet out of a heparin sulfate similar material. And that shows here in this paper, an intact and thick glycocalyx acts as a barrier, preventing the virus from binding to ACE2 and the receptor on the endothelial cells. And even with lipid nanoparticles, the same here. That's interesting. So I think we found another good protection against all these problems. We just have to make sure that the patients have an intact glycocalyx. So it's like a defense barrier. As long as that is intact, we're okay. Problem is that in many, many patients, this glycocalyx is being attacked or has been attacked before they even encountered the virus. These are some of the pathways that are playing a big role in degrading the glycocalyx. And we have done a lot of measurements with our dietary supplements, what happens in the organism, which of these markers are already showing some interesting results. Unfortunately, again, Omicron has mutated in the wrong direction. The spike protein from the Omicron variant is particularly good at binding and destroying these single fibers of that carpet. Yeah, it's like, I would say, twice or three times as good as the wild type and earlier variants. So even if you have an intact glycocalyx, you shouldn't have too much Omicron spike around, because it might degrade slowly your glycocalyx when you get repeatedly infected. Yeah? But interesting is, once you get infected, there is an enzyme that gets immediately strongly upregulated. It's called heparinase. And heparinase eats up the glycocalyx. So once the virus has taken foothold, or the spike, it will elevate heparinase, and then the heparinase will start to take away the glycocalyx and open up the way for new spike entry into your endothelium, like a bushfire. And to prove that this is the case, they took the glycocalyx away with heparinase, and then all of a sudden the spike protein would immediately get into the cells, into the endothelial cells. So that leaves us clearly with the first thing, that we need a heparinase blocker during COVID to prevent that bushfire from expanding in the organism. The product we are using is taking care of one of the biggest problems. It's called MMP9, metalloproteinase 9. And that has shown, if you inhibit that, you can stop the glycocalyx degradation in diabetes, for example. And we can reduce that by 83% in some cultures. Then there's another angle that's very unique to SARS-CoV-2. And that is there is a super antigen, like a Staphylococcus aureus SEB toxin, inside the spike protein embedded. And for several years, I was not able to figure that out until I listened to Charles and Kevin, and they were speaking and said, oh yeah, you're sure you have to cleave the spike protein in two parts, and then the SEB is exposed. And I went like, oh, okay, now I got it. So the S1, once it's cleaved, the S1 is then showing the super antigen. And the super antigen works like, okay, if you look at a helicopter, it flies into whatever, a combat area, then it gets attacked by heat-seeking missiles, and it throws off a lot of flares, like a decoy, to keep the enemy missiles busy. And that's what a super antigen is. The Staphylococcus is kicking out these SEB antigens to keep the T cells busy and keep proliferating. It's like a decoy, but it's extremely bad for the body. The SEB is a very, very, very inflammatory substance, one of the most toxic ones known. Even SEB was stockpiled on a large scale as a biological weapon during the 1960s. Yeah, before it was banned. They probably still have it. So that means when you have the furin, this enzyme that can take apart the spike protein into two parts, if that is elevated, then it will expose more of the S1 and more of the superantigen. The good thing was the superantigen can be mitigated, the effect. And that was really interesting, because that study was done in Fort Detrick by scientists that work on bioweapons. So they actually did my work. I have to be very grateful here. Yeah, so they identified epigallocatechin and resveratrol as the two best agents to mitigate superantigen effects in the organism. No comment. So, and then we have to see that the furin levels, okay, that's the next big factor. So next to the degradation of the glycocalyx, I would say high furin levels are kind of making you prone to get long COVID, because the high levels of furin are caused directly during the infection, but also in any kind of precondition, diabetes 1, arthritis, autoimmune, etc. All these people have very high furin levels. So now the virus and the spike protein, if it hits the organism, is cleaved. So that's why they have so many S1 subunits in circulation, because they have abundance of furin. So furin inhibitors would be a very smart idea in order to bring down the cleavage of this spike in general. Look, without a furin cleavage site, there would be no pandemic. That was the main gain of function done on SARS-CoV-2. And to my surprise, I was not aware of that a long time ago. Quercetin is one of the best furin inhibitors. So good that we have that in abundance. And you can see here on the numbers, this is the amount of spike protein being cleaved. And you can see that it's strongly reduced by quercetin in dose dependent. Yeah? Good news. And then now we have another additional factor. Remember that Carlo was also documenting LPS, liposaccharides from the gut, moving into the bloodstream. And the problem is if liposaccharides, LPS, meets superantigen, they operate synergistically. About 100 times more toxic than each one by itself. So would make a lot of sense to go against the SEB toxicity and LPS at the same time, because the LPS has another array of other bad outcomes, which means, for example, it boosts the pro-inflammatory activity of the spike protein, probably because of superantigen, but they have not figured that out here in this study, but you can see that clearly now. Yeah. So when you measure LPS and you think like everything is hunky-dory because it's not so high, add the superantigen compound to it, and then you will see a cytokine storm and you wouldn't even know why. Yeah, hard to figure out. And this is how this looks like. This is an intact vascular system. Yeah, you have the glycocalyx, the endothelial cell, the tight junctions, or even the blood-brain barrier in between. And then when the glycocalyx gets degraded, then the neutrophils and leukocytes can adhere, can start to attack the endothelium, cause inflammation. The spike protein can go in. We have platelet aggregation and we have platelet adhesion, and thrombosis being now able to stick to the endothelium, thrombi, and you have a break in the integrity of the endothelium, and then there other things can infiltrate. Well, we figured out something else. The moment now a spike protein goes into the endothelial cell, as documented here, it will cause senescence immediately, already on the receptor. So that is one of the biggest problems in SARS-CoV-2 infection and or vaccination. But fortunately, it's also the Achilles heel of that little bastard. Yeah? Because once you have these senescent cells here, they will be susceptible, we get to that later, to certain compounds. Yeah? And that looks then, in reality, looks like what Arne Burkhardt could describe here. This is a cut through a very small blood vessel, an arteriole, and here you see each of these brown dots is an endothelial cell filled with persistent spike protein. Yeah? And so once you have broken through the endothelium, then you have a layer beneath that, the elastic lamina and other parts of the vascular system. And then you have these foam cells, macrophage infiltration, monocyte infiltration, the activation of different other immune cells. Plus, you are going to have an inflammatory cascade, again with MMP9 at center stage, causing the degradation of your elastic lamina around your endothelium, which is not good. And again, so an MMP9 inhibitor is imperative in this position here, when you look underneath the endothelium, because that's what Burkhardt also found. You see, this is, again, blood vessels surrounded by lymphocytes, lymphatic vasculitis with a blood clot inside, and here disrupted elastic lamina fibers from the inflammation, from neutrophil elastase, which will dissolve the elastic fiber and other factors. So this is the final stage, actually, of endotheliitis that you don't want to get into, to interfere way before that. So one thing is for sure, you cannot restore the glycocalyx, which I think we can do, before you stop the inflammation. That's why I put this picture here. If you have a rusty pipe, you can't paint it on the rust. You have to first clear it, and then you can start to do that. and you have to stop the inflammation. So we did a study, UTS Sydney did a study with our supplements, looking at the macrophages, LPS-triggered macrophages, and what would be the main cytokines being triggered by that, and how well would these dietary supplements suppress those. And you can see really, really impressive. TNF-alpha, I don't know, that looks more like 70%, 80%, not so much, but still impressive. And interleukins, all these are going down. And those are exactly the ones that you want to bring down in order, if you want to stop the macrophages and other cytokines producing cells to disturb the growth of your endothelial cells. Because once we have taken them out, we want them to regrow, to restore. And so there were some interesting papers here finding that several compounds like epigallocatechin, resveratrol, and quercetin could do two things within minutes. They could reduce the arterial stiffness, and they could rebuild the glycocalyx thickness in a matter of few minutes. Wow. So we should measure that better now in the patient and see if, after taking care of the inflammation, taking care of the inflamed endothelium, if then we can see an improvement again in it's the pulse velocity that you can measure in the EKG, and you can see that on some data. Now, for example, what is the elastic condition of your vascular system, and the glycocalyx? I don't think that we can measure the thickness, but I think Robin has now acquired a machine that can have a look at the glycocalyx condition. Now we can ask her. So as a summary, there is like 4 big factors that are driving endotheliitis and all the, let's say, the vascular problems we can observe. Most likely LPS, furin, and high heparinase level, leading to glycocalyx degradation, or if the glycocalyx is already damaged in the first place. And we could see that on the hamsters. That's why the hamsters didn't get sick in Japan, because they had an intact glycocalyx. So now we are going to inject LPS first, and then start again with spike protein or lipid nanoparticles. That now brings us to the, wait, do we have any questions on this, Leo or Valentina, so far?
Yeah, what are you using to inhibit MMP9?
That's medicinals.
Right, but I mean, is it it's the whole combination? It's not, there's not one specific single thing.
I will give a recommendation. When I'm finished, I will give you a recommendation for several other things to be added and why they are added. We have learned a lot again in the last months, so it never stops. And so I have some good recommendations now how to improve the supplementation. Let's call it that way. Yeah.
Thank you. So let's move on then.
So the next thing that is resulting and being driven by that is of course the interplay between the spike proteins that are circulating plus the endothelial cells being completely inflamed and fueling thrombosis formation. And these, at the center stage of all this, they are these microclots